Hello, welcome to Perspectives with Dr. Poock. Today I'd like to talk about urinary tract infections. Urinary tract infections are an infection of the urinary system that's very common. Often people refer to them as bladder infections. What it is, it's a bacterial infection that involves the bladder, the urethra, which is the urine tube, and often it can even result in infection in the kidneys, which is much more severe. Many of you have known someone or have heard of someone who has had a bladder infection. Most likely it's young ladies. They get burning, frequency, discomfort when they urinate. There's infection in the bladder. We do a urinalysis to see if there's an infection there, and we can treat it with antibiotics. Often the urinary tract infections become quite severe, particularly if the infection gets up into the kidneys, or if the infection gets into the bloodstream as a whole. It can cause a person to be quite sick. How do you as a person know if they have a urinary tract infection? Again, the most common symptoms are bladder pain, frequency with urination, burning with urination. Sometimes there's an odor to the urine. And in those cases, you need to be evaluated to see if you have a urinary tract infection and be treated. There's some unique circumstances, particularly in postmenopausal women. Postmenopausal women often don't have the typical symptoms, particularly elderly postmenopausal women don't have the typical symptoms of urinary tract infection. Often it presents with they're just off. In other words, they're confused, they feel weak, they have malaise, they just aren't feeling well. Any postmenopausal woman that has symptoms like that, we should consider a urinary tract infection as a source of those symptoms. Men tend to get much less urinary tract infections, but as men get older and have problems with their prostate and fail to empty their bladder completely, that increases their risk of having a urinary tract infection as well. Symptoms for men are very similar: burning, frequency, pressure, often, again, fevers, chills. If a person is having the symptoms of a urinary tract infection and develop fever, chills, nausea, and vomiting, that can be an emergency, and they probably need to be evaluated much sooner rather than later. What can we do to prevent urinary tract infections? The most common way we can prevent it is just maintain hydration, so we're urinating on a regular basis, which flushes the germs out. Women should urinate before and after intercourse to help prevent urinary tract infections. We should teach young girls how to wipe from front to back to prevent urinary tract infections. Avoid douching or other chemicals to the urethral area. And then sometimes in women, postmenopausal women, there's an estrogen cream we can use, particularly if they're having repeated urinary tract infections. It can help minimize their risk of urinary tract infection. And sometimes we have to put people on chronic antibiotics to treat chronic urinary tract infections. Urinary tract infections are very common. They generally are very mild, but they can result in quite severe illness and result in a disease called sepsis, where the infection has gotten into the bloodstream and causes the person to be very, very sick. That's why if you do have symptoms of urinary tract infection and have a fever, nausea, vomiting, weakness, it'd be important for you to go to the emergency room. This has been Perspectives with Dr. Poock. Thank you and have a great day.